Indonesia, a country full of beauty in all its ways. They have delicious food, a beautiful culture, the stunning nature, and of course, not to forget the amazingly nice people living in Indonesia. But the first thing you'll see when you come out of the airport during the day or during the night is this, which is kind of disturbing. During our internship in Indonesia in Dr. Sutomo Hospital, we had the opportunity to speak with multiple doctors and co-assistants about tobacco use and its effects on patients and society. Since the relatively severe regulations in the Netherlands, we were wondering whether we were just biased by this or if smoking was and is a real problem in Indonesia. Some say smoking is part of the culture of Indonesia. That would seem obvious since you will see smokers, mostly men, on every corner, every street, in almost every restaurant, car, hotel, and even schools. We can live with adults and maybe even adolescents smoking. But how about children smoking? Although it's not common, some known cases of children and toddlers smoking in Indonesia have shocked us. How is children smoking even possible? We wonder what is the position of the Indonesian government in stopping smoking and decreasing smoking behavior. Our goals were as follows. Smoking is a worldwide problem, and it's most frequent in the less developed countries. But who are these smokers? Let's start with some numbers. 65% of the males smoke and 23% of the women.
Well, first of all, smoking is a nation, is rooted deep in Asian culture. Usually, you see in other countries other than Indonesia, they all smoke, and then because the parents smoke, then the children will also smoke, just imitate their parents.
The risks of smoking have been known for decades now. Smoking can damage almost any part of the human body. It leads to several types of cancers and chronic diseases. Almost all are long term effects and thus visible after decades. Knowing this, one would wonder what the reasons to smoke are.
They tried because like their friends trying to be cool, so they did smoke because they want to like, oh yes, I want to make a friends with you, so I have to be cool like you, so I smoke.
Do not smoke, some friends will get away from them and they will lose friends because their peer circle, most of them also smokes and drinks.
Well,
Opinion itself is linked to environment too.
Yes.
We're so lucky that we live in a privileged area,
Yeah.
that we know that we have a good education, that we know the danger of smoke, we know that smoking is bad for our health, but some people are not as lucky as us. They live in underprivileged area, they have poor education, they have poor access to health, they have poor access to education, and therefore it's a wrong opinion shaped in their mind, and bad environment influence us.
Yeah, even my nurse, my doctor also smoking. When they become doctor at about age 25, they start smoking at the high school. High school is everywhere. I ask my patient, how old when do you start smoking? Actually, almost All of them say they start at the teenage high school or after high school. You see, but even young people, I have maybe you see now at the street, yeah, maybe they start smoke at 12, 13 years old. I even have a patient start smoking at the age 7 or 8, and the parents feel proud. Feel proud.
Empower is a tool from Tobacco-Free Initiative of the WHO. It helps countries in the implementation of interventions to reduce the demand for tobacco. The biggest challenges for Indonesia are the protection of its population, offering help, and enforcement of regulations.
Some music concert and then have so many commercial in the television, in the paper, in the so many you see everywhere in the billboard, big billboard in the street.
So what? So the advertisement they're trying to sell is like, if you smoke, you can get a lot of, happiness or fun, or it's like an adventure. That why don't you try? Why don't you smoke? Trying to be cool and well.
And you must educate more. If people are aware that smoking is dangerous for health, I think they will choose not to smoke. You cannot stop the industry. It's so big and it's so many people, thousand of people work for the cigarette industry. Actually, I forget there is a drug for to help the people who stop smoke, but it's expensive, and also you must take it regularly for about 3 months. But I forget the name of the drug. I also offer them. Often they ask me, actually I want to stop, but I cannot. So I ask them, do you really want to stop? Really want to stop? There is a drug to help people overcome the addiction. A few of my patients have taken it, but a lot of them fail because they stop in the middle of the course of the treatment. Because I think the main cause of the failure is a lack of the spirit or commitment to stop smoking.
For the primary healthcare, we have a program like we prohibit the family to smoke in the house, to smoke in public places, because the government try to limit the places where they can smoke. They build a smoking room or smoking area for people to smoke.
Remember 10 years ago, the packaging of smoke is still nice and fresh, and it's like made by a designer, but now the government has implemented new law that stated the packaging of cigarette must contain picture or photos of a risk accompanied by smoking, that is lung cancer or any other cancer, and to display warnings on the package of the smoke bigger than the usual.
Yes.
The law was created, I think, in 2013 or 2015.
According to this tool, Indonesia has a long way to go. One would wonder why not more effort is put into the tobacco control. Indonesia is one of the few countries that did not sign neither ratified the WHO Framework Convention on Tobacco Control, which is a treaty that reaffirms the right of all people to the highest standard of health and focuses on reducing addictive substances such as tobacco.
The smoke customs, some percentage of the smoke customs, we use it for health, for our health insurance. Our health insurance is quite new, it's just established in 2013, and we have a massive debt of $500 million, and the government covers it partially from the tax that they get from smoke.
Yeah.
So
it's quite fun.
some people have been against it, and we don't really know because it gives bad and it gives good also in the other hand.
In 2018, over 300,000 packages were sold. This led to a revenue large enough that some part of it could be used to finance the healthcare system. Although this sounds crazy, it is true. The anti-tobacco movement was the first organization that nonetheless tried to raise awareness for the dangers of tobacco use. The Indonesian anti-tobacco movement was founded in 2014. It is a group of people who are trying to make a change in the current situation of tobacco in Indonesia. According to a spokesman, they don't have good results until now. A spokesman of this movement told us, "Right now, we're coping with some major problems. First of all, progress in anti tobacco actions is mostly depending on the willingness of regional political leaders. Some are not supporting the Indonesian anti tobacco movement. The implementation of regulations is another big problem. We do have laws on paper, but the implementation is poor. The power of tobacco producing companies is another barrier. Last but not least, we face new problems with the rise of e-cigarettes. The movement has fortunately accomplished some of its goals, although help is still needed to make progress.
We need teamwork, and what comes to my mind is first the Ministry of Environment. They should implement more shape law to prohibit people to smoke in public places. But in the same time, they still have to offer the smoker some places, maybe closed places to smoke. And the second is from the Ministry of Agriculture, because some people in Indonesia, most people who live in farm, they grow tobaccos. And when the government raise their customs, the tobacco farmer will be affected, and they
Getting more money.
rallied against the government because they didn't get any profit.
I think I agree with you guys that fighting smoking people is not easy, right? So I think the first change that breaking the smoking people is comes from the family. So we have to educate the family first to not smoke, and then after we succeed, the family. I think we go to the bigger circle. Maybe we can invite our neighbor to not smoke. So I think we comes from the small circle to the bigger circle.
So I must, every doctor must spend maybe time to motivate people to stop smoking. And but I think it's not individual movement. I think we need a great movement from the community. Maybe we must approach the high school to offer our program, to show the danger of the smoking, like that. I think it cannot be individual. Maybe a doctor association must make a program and offer them to the high school or university, like that.
Advise them, give the community example. Don't just talk, but give example.
Yeah.